Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. At the conclusion of today's presentation, we will open the floor for questions. You may submit your questions anytime throughout today's presentation by using the chat window located on the right of your webinar. It is now my pleasure to introduce today's first presenter, Mr. Chris Hund.
Thanks, David. Hi, everybody. Good morning or good afternoon. Welcome to the February monthly TeamSTEPPS webinar. We're happy to have you today. Today's topic is on TeamSTEPPS implementation, fostering buy-in from the front lines to the C-suite, and very excited to have you on to hear from Dr. Robert Smith from MetroHealth in Cleveland. I look forward to him sharing his story with you, and I'll tell you more about what's going on with them in a second. But I just wanted to first set a couple of ground rules. So just to let you know, the audio for this webinar could be accessed two ways. It could be through your phone. Also, you could listen through your computer. If you're going to listen through your phone, what you're going to want to do is look at the top at the green button that you see up there that has the speaker, and make sure that you mute that speaker button. Because if you don't do that, I think you get a lot of feedback or echoes. So that's just one of the things that you want to make sure that you do. If you would like to listen through your computer speakers, though, and not through your phone, please note that you'll not be able to ask an audio question if we get to audio questions later on. However, there is a discussion area where you could chat questions in. So that's pretty much what we like you to do anyways. We prefer if you, throughout the course of the presentation, chat your questions in that chat area that's on the bottom right-hand corner of your screen. The reason we ask that is oftentimes you might have a good question that you think of at the moment, and you can put it down in that chat area, and then we'll queue them all up and try to create a cohesive question and answer for Dr. Smith at the end that I'll just moderate and ask him. If we do exhaust all of our chatted in questions, we will open it up for audio, but that doesn't always happen. If we have questions left over that are in the chat area that we don't get to, we'll be sharing those with Dr. Smith, and he'll be able to answer those, and we'll email them out or post them online, depending on the number of questions we get. I'd like to take a quick moment to thank Dr. Jim Battles from the Agency for Healthcare Research and Quality and Ms. Heidi King from the Department of Defense. Both of these organizations are the organizations that led the original creation of the TeamSTEPPS materials some 10 years ago now. And Jim is, and AHRQ is actually the project funder for this webinar, so thanks to AHRQ for making this a free event, making all of our events free events. I'm the Associate Director at the Health Research and Educational Trust, and I have the good fortune of being able to run the national implementation of TeamSTEPPS and other TeamSTEPPS work for Health Research and Educational Trust, and we're an associate of the American Hospital Association. So AHRQ funds us to do TeamSTEPPS trainings both in the acute care setting and in the medical office setting around the country. I'd also like to mention Impact International and Dr. David Baker, who leads up that team, who's very integral not only in getting content together for webinars such as this, but also with a lot of our other work along measurement and evaluation of the project. Just a few words, like I do every time, just to make sure everybody knows about TeamSTEPPS. There is a TeamSTEPPS Master Training course. That's a 2-day course. We have these held at 8 regional training centers around the country. One of them is MetroHealth, who you'll be hearing from Dr. Smith later on today. But these are train-the-trainer sessions where we expect you to come in with a team of 3, learn about TeamSTEPPS, and learn how to take TeamSTEPPS back to your institution to share it with others. One of the real focuses of the training is not only teaching you how to teach TeamSTEPPS, but more importantly, of looking at TeamSTEPPS as a quality improvement tool and helping you assess a very specific, measurable problem that you bring to the training that you want to solve. So very good trainings, you get to wear a lot of different hats. You get to be a learner, you get to learn how to teach it, and then you also get to work on a quality improvement project that TeamSTEPPS is able to help in your organization. A couple more announcements before I toss things over to Dr. Smith. We do have monthly webinars such as this one scheduled through September 15, and right now registration is also open for our March webinar, which is on coaching, and is actually with individuals from Carillion Clinic in Roanoke, Virginia, who are one of the original TeamSTEPPS master training sites, and very, very much an interesting story that they have and a lot of good skills around coaching. We do have master training courses, and there are courses from that are available still open for courses in April and May, and very soon we'll be launching more training courses, available registration through the end of August. And if you're not able to travel, there is also the TeamSTEPPS 2.0 online master training course. And this course is something that you can register and enroll at the URL you see on the screen right now. And this is a really wonderful opportunity for you if you're not able to have the funds to go to one of our regional training centers, or if you're from a hospital that perhaps you already have people that have come to a course. We do try to keep things to teams of 3 so that we can reach out to as many hospitals as possible. And so that's why the online course is also a great option, so more people from your hospital can learn about TeamSTEPPS. We really do hope that since it is a train-the-trainer type course, that after you come to our course in person, you're able to go home and teach others yourself. So a couple other events. Our annual conference is June 16th through 18th in Denver this year. It's a really great opportunity to come learn from other people, but also really make a lot of connections with other people that are interested in TeamSTEPPS and team training from around the country and really around the world. People always come. So it's a good conference. Usually have well over 500 people attend, and so a great opportunity for you. Registration's open for that right now, so head on over to TeamSTEPPsportal.org to learn about that and to learn about all the other events I talked about. If you ever have any questions or need any help, the phone number on the screen is who you call, and we get back to this email and these messages within 48 hours. So please do send us messages or call us. This is available, this number and email address, also on TeamSTEPPsportal.org if you have any sort of questions about this. All right, enough about me and about all my announcements. Now I'm going to turn things over to Dr. Robert Smith, who is the Director of the Medical Staff Assistance Program at MetroHealth System, which is in Cleveland, Ohio. He's also an Assistant Professor of Psychiatry at Case Western Reserve University and the School of Medicine at MetroHealth System. And where I know Dr. Smith from is from amazing work that he and MetroHealth have done on TeamSTEPPS. I actually got to meet him at a training at one of our regional training centers at UCLA not that long ago, and they have done some phenomenal work in their system and have actually got to the point where they're one of our regional training centers now, and I couldn't be happier for them and for all their great work, and I'm happy now to turn things over to Dr. Robert Smith. So over to you, sir.
Thanks, Chris, for those kind words. Greetings, everyone, from Cleveland, Ohio. It's a balmy 18 degrees here today, so we've all got our sunscreen on, and we're, trying to stay out of the sun. What we're going to do is we're going to talk about MetroHealth indirectly. So what I'm going to be doing is I'm going to be sharing with you our lessons learned. So what are the things that we've come to realize have worked for us in engaging our C-suite, our managers, our administration, as well as our front lines. What are the things that were helpful and brought people on board and made them excited about TeamSTEPPS, and what things didn't work quite so well, and how have we changed? So that's basically the goals of today's presentation. But let me start with who is MetroHealth, so you have an idea of the area that we've been working in. MetroHealth is a hospital that's been in Cuyahoga for now 178 years. It's one of the largest healthcare organizations within Northeast region, and we have a 700-bed hospital and 17 community health centers. Total staff is about 6,800. Our goal is to train all 6,800. So for those of you who are thinking about an organizational implementation, I'm going to touch on that. But that's not the only way, of course, to implement TeamSTEPPS. You can bring it into your unit or division or department, and I'll talk about the different ways that you can approach each of those different strategies. Within our organization, we have about 476 primary care physicians, 1,200 registered nurses, 145 advanced practice nurses. We have 24 residency programs for a total of 374 interns and residents. We have 15 fellowship programs for 55 fellows. And overall, we have over 1,000 students that come from the medical school, Case Western Reserve, where we're affiliated, and then in other healthcare training programs. In terms of patient care, last year we had 28,000 inpatients, 2,900 newborns, over 1 million outpatient center visits, and over 100,000 visits to our emergency department. So what you can see is that, again, we're not one of the largest healthcare systems in the nation, but we are a fairly large county facility, and we have large volumes within our clinics and in our emergency department. We're also a level 1 trauma unit for the Northeast region of Ohio. So all of the things that we're talking about so far, we have implemented TeamSTEPPS with our emergency department, our OR and PACU, labor and delivery, NICU, and postpartum, with our administration, because again, we're doing it for all 6,800 employees, so we're including our non-clinical as well as our clinical. And right now, PM&R is just finishing up. Our finance department is just getting ready. We're probably at about a little over 2,000 trained so far, but we've got a ways to go. But let me talk a little bit about how do you get started. Key thing is, first you need a champion and you need a change team. These are the persons who are going to lead the initiative and really sort of spearhead making the organization aware of TeamSTEPPS and thinking about, do we really want to do this? Now, in terms of a champion, you may want to think about, Dwayne Johnson becoming the sort of poster child for TeamSTEPPS. As you can see, he's the champion of a new era. What I really like about him is his nickname, The Rock. When I think about the champion really does need to be The Rock. They're the first person who is going to step forward and say, let's do this. Let's make this happen. And that individual is going to have to be passionate, really believing that this is going to make a difference for the organization. They need to really capture the concept that this is a culture change, not an educational or training program. They need to be confident. There's going to be pushback when you start to talk about TeamSTEPPS, and you need to know that this individual is not going to be dissuaded or their confidence shaken by persons challenging them. They need to be respected and knowledgeable, both within their field, but also about the organization, and know how to sort of exert their influence to make this process occur. The other thing that's really important is they have to be able to dedicate time to this project. Implementing TeamSTEPPS is time-consuming. And the persons who are going to make a commitment need to be able to look at their schedule and carve out the time to be able to host meetings, to meet with departments, to go through all the steps that are going to be necessary to make this a reality. They'll have to own the project. And when I say that, what I mean is that you're going to have your change team, and they're committed, but they have their other jobs. They have their other duties and responsibilities. When they get that tug of, I need to do my daily activities versus a team step activity, there's a chance that they may pull away and go and do their job, as they may need to do. The champion has to be prepared to own the project and make sure that it doesn't fall through the cracks and that it doesn't sort of lose momentum. The champion has to be prepared to make a lot of presentations. You're going to have to get in front of lots of groups to share the rationale, the proposal for the project, and to persuade people that this is worth the investment. And they need to understand the culture. Every organization, every department, every division has their own unique culture. Without understanding that culture, you're not going to be able to engage people and persuade them that this is worthwhile. Okay, so we've got our champion. Then we need to think about building a team and putting together people who are going to be what I call the first followers. If any of you have the opportunity, you might want to go on YouTube and take a look at the video called The First Followers. It's a wonderful video, very entertaining, but it emphasizes that the champion, although they're important, the first followers are really key to this process. Change team are the people who are going to be able to spread the message and to be able to represent many areas within your organization. So again, they need to be influential and passionate. They need to have the respect of their peers. They need to understand the culture. But then the other thing that they should bring to the table is they should have access to information that you're going to need about the individual unit, division, or department. That they know how to access resources when you're thinking about moving forward with training. Where are the rooms? Where is the audio-visual equipment? How are we going to arrange for people if they need to come with for overtime? How do we teaching? So they need to be leaders, and they need to communicate well. Excuse me. If they don't have those characteristics, they're not going to be good change team members. And then lastly, you want to create your change team in a way that they represent all of the key areas where you're going to be taking team steps. One of the things that I emphasize in my leadership training, excuse me, I have a frog in my throat. One of the things that I emphasize in my leadership training is the importance of having the right people at the table. How often have we had a project or a concern within our organization that we're trying to address, and we have leadership there, but it's the wrong leadership? Or we've ignored the frontline staff who live with this issue every day, who truly know what's going on and what needs to be done to make an improvement. So, building your change team, be thoughtful. Who are the people that I need at the table? Do I have the right persons? Do I have the people that will have the information and have the resources that we need? The change team is going to be responsible for really gauging what's the real interest of the organization, the department, or the division. So in other words, lots of people will say, TeamSTEPPS, that sounds great. Oh my golly, yeah, we've got to do that. But it's simply just an idea. When it comes down to the real work and making it happen, then suddenly the interest starts to wane. So the change team needs to monitor and measure that. Change team should also review the literature that's relevant to what you're hoping to do. So if you're looking at doing it on an organizational level, there's TeamSTEPPS literature out there that you'll want to review. If you're looking at it for your emergency department, labor and delivery, whichever area, again, you want to do a lit review and take a look at what's been done in building teams within those types of departments or divisions. And then in the end, you need to ask, what other organizations have done this? So we are very grateful to Lily Thomas and her group at North Shore Long Island Jewish Healthcare System. They've been our mentors throughout this process, and they've been wonderful. We've had a number of phone conferences with them, and we've actually been visited with them to take a look at what they're doing and to see how that might work or fit for us. Once you've accomplished all of that, then you want to know, so are we committed to this? Does the change team believe that this is the right fit for your organization? What I've put here is just a slide demonstrating the people we put at the table when we established our change team. And as you can see, I drew not only upon clinical departments, but I also drew upon our union, marketing, diversity and inclusion, communication, our SIM Center, organizational development, so that I knew that those areas had resources that I was going to need. And so I wanted to pull them in from the beginning. If you're looking at your unit, division, or department, again, you want to think about having the right people involved right from the beginning. Your medical director, your nursing manager, representatives of all the disciplines that work within that area, so that you can incorporate their ideas and their perspective as you begin thinking about how you're going to implement, train, and then establish your projects that you're going to use TeamSTEPPS to improve patient safety. So now here's one of the most important areas and probably one of the most challenging. Getting buy-in from your administration to get the C-suite to support the whole idea of this implementation. So again, make sure that you present to them the research that you've conducted and discuss the organizations that you have been collaborating with. I heard a phrase the other day that I loved. They said, data tells, but stories sell. So again, you want to present that research data, but be sure that you then make it real and tell stories about how it reduced patient stays. It reduced infections. It increased patient safety so that they can understand how TeamSTEPPS will translate into real-life changes. Then you want to be able to present to them why our organization. So TeamSTEPPS is a great idea. Sounds like, it probably does some good things for other places, but why should we invest time, resources in doing this in our organization? Best thing I would suggest is use your existing data that you gather within your organization. You have quality data, you have risk management data, you have patient satisfaction data. Look for the opportunities for improvement. Look for ways to make things better within, again, your unit, division, department, or organization, so that the administration can hear why this will make an improvement for you. For those who need to look at the bottom line, be prepared with data that talks about cost. So one of the things you'll want to look at is your malpractice data. If you can gather your malpractice data for the last 5 years, then get with your risk management department and look at those malpractice claims and establish what percentage of the claims were due to a breakdown in communication and teamwork. And what does that translate into in terms of number of dollars that the hospital had to spend as a result of those claims? Suddenly the investment in TeamSTEPPS does not seem so great and seems like a good investment. you want to go ahead and project what the cost is going to be for conducting the training of your staff. The way that we approached it is we took all of our job classifications, average salaries for those job classifications, and then multiplied it by the number of hours that they would be away from work for the training. And so for MetroHealth, it was about $1.2 million. Again, when we looked at our malpractice data, that was not a significant amount if we, in fact, are successful in changing our culture and improving patient safety. Of course, there's going to be someone who's going to say, all right, we do this. We spend this money. We give people time away from work. We let them go through the training program for TeamSTEPPS. In the end, though, what's the return on our investment? What will we get? Well, again, you want to go back to the literature. You want to share with them what the expected outcomes should be based upon what they've seen in other organizations. But you have to help them, again, understand this is not an educational program. This is not a training program. This is a change in culture. And so that they understand that when you complete the training, you're not done. Provide them an overview of your plan. If you're doing something on an individual unit, share with them what your project is. What are you hoping to do? Are you looking to change your medical rounds and to make them more team-oriented, to improve the communication around treatment planning? Are you looking at transitions within your hospital from the emergency room to the medical floors, or from the OR to the PACU? You want to look at those projects that you're planning on doing and explain them to them and what your goals are in doing all of this training, and then how it's going to be implemented and sustained. Now, key thing is, in your passion, don't oversell. First of all, avoid tight deadlines. Probably one of the most interesting things here at Metro is when I was starting this process, people kept asking me, what's your timeline? How long is this going to take? And I kept dodging the question. I would say, I'm not sure. Or that's a great question. And they'd say, yeah, but how long is this going to take? And each time I would need to explain to them that it will take as long as it takes. And I'm going to explain that more in a few minutes, but the point is that this is not simply a sign up the department, run people through the class, and then we're done. It's not an educational program. If we're going to really change the culture, there's a process that you need to go through to engage people within the department, and that they take ownership, and that takes time. So I would again just encourage you, avoid tight deadlines, and do not anticipate that you're going to get any favorable results right away. Plan on waiting 6 months to a year after you've implemented your project and you've used your intervention to improve patient safety and conditions. Then do your follow-up and measure. Present the fact that you have measurement plans in order, what your measurement tools will be, and what your plan is for sustaining this once it's implemented. Your C-suite is going to feel much better if they see that you've thought about all of these different factors, and they're going to see this as a good business model. Now, we were fortunate when we were doing our implementation, we had a number of changes going on within our organization. We had a new CEO come on board. He bought into TeamSTEPPS as well as the administration, and we went through a number of changes because of a new CEO. We re-examined our mission statement, and we were able to incorporate teamwork into the mission statement. We also took a look at our core values, and we developed what's called STAR IQ. And if you notice, the second value is teamwork. So that made our whole organization recognize that teamwork is part of who we are and how we serve our patients. So they gave us not just the financial support and the go-ahead to pull people out of their day-to-day work to go through training, but they also endorsed the whole idea of teamwork as part of who MetroHealth is. So again, as you're thinking about what you want from your C-suite, the administration, think in terms of culture change, not just funding for a training program. Okay, now moving on. We've got the buy-in from the C-suite. Now we're thinking about we need to train people. The nice thing about TeamSTEPPS, of course, is it's not a consultant activity. You're not hiring people from the outside of your organization to come in and tell you how to do your jobs. Rather, what you're doing is you're selecting staff members who are going to become trained in TeamSTEPPS and become master trainers. And they're all going to be wise, just like Yoda. The master trainers are going to be very much like the persons who you have for your change team, except there's a couple of additional things I would add. These individuals have to be extremely comfortable in front of a group. They're the master trainers. They're the ones who are going to be training your instructors, who are going to be bringing this to your division and your departments and throughout your organization, depending upon your plan. They've got to be creative, thinking of how you're going to take this template of how to teach TeamSTEPPS and make it relevant to your staff, to your culture. So they have to be creative and fun. They have to be able to educate people, and then they also have to be able to facilitate. Because in the training process, you don't want to just throw information at your students. You want this to become something where people are truly engaged and that they get to share their ideas, their reactions, and ask their questions, and really learn and begin thinking about, well, how would this really change how I do my job if I took this and really embraced it? Again, master trainers are going to have to be able to commit time. Time becomes really, really a factor here because they're going to be conducting training for your instructors, and they're going to have to go to a regional training center to become master trainers. They're going to need to come back and help create the curriculum for your instructors, and then they're going to need to be available to support and coach your instructors. Okay, so now you've made it through the fact that you've got support from your administration. You've sent your master trainers off to regional training centers. They've come back. They're all excited. They've got a lot of ideas for curriculum. And now it's time to actually go to the department where you want to do your training and to get their support. I would suggest that you follow the procedure, in fact, that TeamSTEPPS encourages. Develop a survey. You can use an existing one like AHRQ, or you may have one internally that you use now. But it should assess the division or department's strengths and weaknesses. How do they view patient safety today? How do they view communication today? How do they view the team's interactions today? So that you get a sense of what are the opportunities for improvement. So you get that data from that division or department. It's confidential. You put it together. You organize it. And you present it to them in a way that they can see how they rate themselves. Where did they see the weaknesses and the opportunities for improvement? And you present that data to them. And you tell them all about TeamSTEPPS. You get the master trainers to share their enthusiasm and why they think this will be helpful and useful. And then you ask for volunteers to to become instructors. Because again, this is not the master trainers coming from outside into a department and now teaching them how to do their jobs. You want instructors that represent that group. So if it's a medical unit, you want some of the attendings to become instructors, nurses, physical therapists, ward clerks, environmental services. You want to get a representation of that whole unit to become instructors. And you want to engage them. They will then go through training, and you'll teach them how to teach TeamSTEPPS to their area. Now, it's interesting. I mentioned earlier that you have to pace yourself in this process. Because as you approach your division or department, you may find they're not quite ready. Send out the survey, and you don't get very many back. You ask for volunteers to be instructors. There's not very many volunteers. And in fact, as you listen to their feedback, you hear things like, oh my golly, not another training. We don't have time for this. And you also discover that the director, the manager, the department chair really are not invested in this. You need to stop and not push forward. Again, this is not just a training program. We're not running students through a class. What we're trying to do is engage people so that they will actually use the skills and change their environment. So slow down and realize that you're going to need to help them get ready. Sometimes it may even feel like you're this one person who is trying to push forward a change related to TeamSTEPPS, and everyone else seems to be pushing back against you. So how do you overcome the resistance? Well, first thing is you need to enlist the chairperson, director, and manager. If they've got doubts, if they're uncertain, if they think the agenda is too full, pay attention. Slow down. Maybe now is not the time. Maybe you have to wait 6 months. Maybe you will need to provide them with more education. Maybe you need to encourage them to go through a class to become an instructor to help them understand what TeamSTEPPS is all about. Get their support so that you can get adequate survey data. Drill down with the data, and oftentimes you may find what some of the sources are for the resistance. And then share this data with the department chair and director, and then eventually bring that back around again to all of the staff. You may even want to consider conducting focus groups with the staff to discuss their reactions and their resistance so that you can be more informed. The key is to be patient but persistent. Don't give up. Just keep going back and working with them. Our OB department, wonderful staff. The department chair said, we're ready to go. Let's get started. I said, wonderful. Let's get a meeting and we'll meet here in the next couple weeks. Scheduled a meeting and there were 3 people there. I got together with the chairperson. He said, how did that meeting go? And I said, well, there were only 3 people there. He goes, well, that doesn't sound good. You need to do something about that. I said, well, no, I don't know that I need to do something about that. I think I need your help to do something about that. So he said, well, what do you need me to do? And I said, well, I think what will really help us is if you can actually come to the meetings. There was a long pause, and he said, wow, I don't know that I have time for that. And I said, well, maybe we're just not ready to do this in OB yet. Again, another long pause, and then, well, I didn't say that. I said we were ready. I said, well, if you're ready, then I need you to be there. All right, okay. So he met, and the group grew. We decided to do not just labor and delivery, but also NICU and postpartum, all 3 areas at the same time. That required a lot of planning and coordination. We had to get instructors identified and get them trained. And this is no pun, it took us 9 months. But when they were ready, they had 26 people in the room, all trained as instructors, all ready to go. They had developed a curriculum specific for OB. They had arranged for their rooms, their schedules, audiovisual equipment. They had everything together, and they were ready to teach. They had taken ownership of the whole process. Not the master trainers, the instructors from OB. Chairperson came to me at that point and he said, now I understand. This whole period of us preparing and working through all of the sort of barriers and speed bumps to putting this together was part of TeamSTEPPS. I said, now you get it. That's right. We now have engaged your staff. This is going to go much better. They've now completed all of their training. It was over 400 people, and they're now moving on to their projects. Now, as I mentioned earlier, if you're going to engage staff, one of the things you want to emphasize is this is not a consultant activity. I think that many healthcare organizations have experienced during the last decade the sort of flurry of activity around bringing in consultants who are experts in whatever area, and then they put together a plan or intervention which is going to make you more efficient, more effective, improve the bottom line, and oftentimes the results have not been very positive. The nice thing about TeamSTEPPS, this is not a consultant activity. The program is not highly structured. There's a template. There are key concepts. But the program itself is very flexible, and we're not going to impose any particular training on a given division or department. Rather, we're going to design the program to be relevant to them. So when we do our trainings, our simulations, our role plays, all of those scenarios are designed specifically for the division or department, with those staff members designing that training. So that when we do a simulation, it's relevant to them. So for instance, one of our non-clinical areas is the foundation. We decided to do a training with them, and our simulation involved the awarding of a grant, as opposed to a medical simulation where we may do something with the code. Also make sure that you use adult learner models of instruction. Avoid PowerPoint. I don't know how many of you are dead right now, but this is the worst way for you to learn. Death by PowerPoint. Give lots of opportunities for role plays, simulations, questions, and discussions. Avoid one-size-fits-all and make the experience fun. There are tons of YouTube videos, lots of games and activities that can be incorporated into your training that accomplish the key concepts you want to teach without making it drudgery, but instead making it a lot of fun. This is something that we truly, truly believe at Metro. If you believe and you have a quality team, and you take something wonderful, you can turn it into something magical. Thank you.
Thank you, Bob, very much. It was a great presentation. Really enjoyed it. We have a couple questions that have come in over the chat functionality that I'll ask now that we've not had a chance to ask or answer yet over the chat. So, starting off, when you're thinking about putting together a TeamSTEPPS program, who's the type of person you recommend to be a champion? Do you think that it should be a physician or somebody in quality, or do you think it varies?
I think it varies on your culture. Now, the interesting thing is I'm a clinical psychologist,
right,
and that somehow just fit for our culture. I'm part of the medical staff. I interact with lots of departments and divisions, and so I had a lot of visibility, and so that worked well for me. But I think that's the key thing. They need to be respected by your organization. They have to have a fair amount of visibility, and they need to understand the culture and be able to influence people and persuade people to want to take on TeamSTEPPS.
So, as we get, without getting stuck into the way that things are named and people are named, do you think that, and I think the answer is yes, but the champion is often also somebody that would be involved as a master trainer too? They should have that skill set?
I think they have to. One of the things I believe is that whoever is going to be your champion and your change team, they all have to go through training. Now, I think your champion should be a master trainer. Your change team may only go on through training to become instructors, but they should all go through the training. We, in fact, have had all of our administration go through the TeamSTEPPS instructor training class. So, yeah, you can't sell something that you don't know. And to really, truly be behind TeamSTEPPS, I think the champion has to be a master trainer.
That makes sense. So you've had, you've had now a lot of experience over the past couple of years working in this, and you've been very successful. Do you have any suggestions, and maybe you've seen this in specific departments within Metro, where there is, maybe there's been a TeamSTEPPS implementation, but it's not been sustained? What would you recommend they do? Would you recommend that they start all over? Would you recommend that they maybe try to pinpoint a specific issue to work on and just work on that? How would you go about this?
Yeah, I think if you found that you didn't get the traction that you had hoped for, what I would do is I would pull together your team on that unit or division and have them sort of regroup. Rather than sort of pursuing something that's hit a dead end, I would suggest that you create something that's very attainable. One of the things we try to do very early along is to have our first project be that low-hanging fruit, something that we know that will happen quickly and easily, and people can feel good about it and see that TeamSTEPPS really made a difference. So one of the things I would caution you is don't take on too aggressive a project right from the start. Pick something that's pretty manageable, that you know that you can do and measure.
Can you give an example of one of those very low-hanging fruit projects that you might have gone after early on?
One thing that's going on right now with our operating room is that they were noticing that all of the beds in our organization are not necessarily designed for the oxygen tank to hang on the bed. And so we've got portable hangers that you can just throw on the bed, but then they disappear. And so the result is you end up with staff in the OR running around trying to find a hanger or a bed with an attachment for the oxygen tank for the patient so that you can transport them up to the floor. Well, now that's not good patient care. It's frustrating for the staff, and it's a pretty easy thing to fix. So the team identified this as a problem. They saw it as a patient safety issue and a staff satisfaction issue. They pulled together and put together a group that's investigating, and we're now making recommendations for new beds, which are to be purchased here in the next month. We've made recommendations for those. And the other beds that we have that are not going to be replaced, we've now found a vendor that will put a bracket on those beds. Really a pretty easy project. Everyone agreed that it was necessary and useful, and the budget was not extreme. So it's, again, one of those low-hanging fruit kind of things.
So low-hanging fruit, definitely important. Obviously, being able to measure is how you gain that traction and spread and use this as your kind of sell when you go into a new part of your organization. Did you have a specific matrix that your system utilized for outcome measures?
One of the things that we're doing right from the start is we use the AHRQ survey in every area before we begin. And then what we do is we follow up about 6 to 9 months after we've implemented TeamSTEPPS and our intervention. And then we re-administer the survey, and we're able to get pre and post. Now, projects, we have more specific measures, but we do that with every project.
Got it. So do you have any experience with the multi-team systems where team members might be managing both the work of others as well as outcomes across teams, especially since you're kind of doing an organization-wide TeamSTEPPS?
Yes, what we've got now is we actually have action councils within our, wherever we've completed a TeamSTEPPS training, we create an action council. That council is ongoing. That's part of our sustainability. And oftentimes what we find is our projects go across departments or across divisions. And we have now encouraged our action councils to have representatives from those different divisions or departments. So labor and delivery, NICU, and postpartum, they share patients, they share staff, and there's a lot of overlap. And so now their action council is looking at ways that they can improve their communication between those various divisions, the handoffs for patients between them. So there are a lot of different ways to improve the communication and to facilitate, again, those transitions.
Thanks, Bob. And going back to something, when you mentioned the AHRQ survey before and measurement, you're talking about the SOP survey, the Patient Safety Culture Survey?
Yes.
Okay, that's what I thought. Just wanted to make sure. So if you, in your, I'm assuming you guys are dealing like everybody else with EHR implementations, have you seen any examples of TeamSTEPPS in your organization being applied to successful EHR, EMR implementation projects?
That's a great question because every one of our action councils has a project right now with the electronic medical record.
Okay.
We have, the OR is looking at order sets for pain medications for patients coming out of the OR. Rather than having to run around and find the doctor to write the pain medication orders, we're now working with them to develop an order set, and so that they'll be able to just click off on that. It'll be much more efficient and timely. We're also taking a look at ways for anesthesia to post their information following an operation so that the receiving medical floor can see that information. So it's readily available to them when we're doing the transfer of the patient from the PACU to the floor. So there's several projects right now taking a look at how can we use the electronic medical record to get that information to the right people when they need it.
That's great. I know that there's been some discussion, but I don't think there's actually been any studies yet about staff satisfaction improving because of TeamSTEPPS. Have you noticed kind of anecdotally that there's an improvement in staff morale or just general satisfaction because of this, or is it not something that you've been able to correlate?
No, we've actually measured that.
Okay.
With the AHRQ survey,
yes,
we had questions related to job satisfaction. And so we now have two divisions that have done their follow-up AHRQ survey. And for those departments, or I should say those divisions, we've seen a 20-point increase.
Wow.
Staff satisfaction, yes, we're very pleased.
That's great.
Now that was directly related to the implementation of a new rounding process. And so by changing our rounding and incorporating the residents, nurses, physical therapists, and others in the round, and having a structured checklist with a call-out and a check-back, we're finding that actually the persons who are participating are probably working harder, but they're having a better time. They're feeling more valued, and they're feeling that their participation in the rounding process makes a difference.
That's great, Bob. I know we are at the top of the hour. We have a lot of questions, so we'll forward them to you, and we'll make sure that we get everything answered that everybody put in. A lot of, like I said, great questions. Thank you. I think it shows what interesting kind of nerves you touched here in this, Bob, and I really appreciate it. So thank you for joining us today, and everybody will be posting the answers to the unanswered questions up on the portal, the TeamSTEPPS portal. And as always, feel free to contact us at AHRQ@aha.org if you have any more questions. So thank you very much, and we'll get your questions answered. Have a good day, everybody.
Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this afternoon.